More voices are rising, calling for an end to the national state of disaster. In March 2020, President Cyril Ramaphosa declared a national state of disaster to deal with the COVID-19 pandemic. For almost 2 years, it has been extended over and over again. But medical experts say most of the measures in place are simply unfit to deal with where South Africa is right now in the fight against COVID-19. To discuss, we're joined by the head of Infectious Diseases, that department at Wits, Professor Jeremy Nel. We're also joined by a Professor of Vaccinology and Dean of the Health Sciences Faculty, Professor Shabir Mahdi. Thank you, Professors, for joining me. You both put your names on quite a hard-hitting piece outlining why you think we should move away from a national state of disaster and most of the restrictions that we have in South Africa. My first question to you, Professor Mahdi, it feels like scientists, experts are fed up. Are you feeling fed up?
Well, I don't think it's a matter of feeling fed up. Certainly, everyone is fed up about COVID-19 and how the manner in which it has disrupted our lives. But that is not the reason to get rid of restriction. The reason to get rid of the type of restrictions is we're in a very different phase of the pandemic. And the dynamics of the pandemic has changed. The dynamics of our ability to protect ourselves against severe disease and death has changed completely. In that, despite the modest rollout of COVID-19 vaccines in South Africa, a large percentage of the population, more than 3/4 of the population before the Omicron wave, already developed natural infection-induced immunity, which is protecting extremely well against severe disease and death. And it's probably it will likely continue protecting us even when there is another resurgence, which will probably take place in a few months, and even if there is another variant. So it's really underpinned by the scientific rationale for the lifting of restrictions and the scientific rationale to move away from a state of disaster. Because if we are wanting to have a state of disaster, we should have a state of disaster to prevent the 58,000 people that will likely die of tuberculosis during the course of 2022. And it's extremely unlikely that COVID-19 will come anywhere close to that number in terms of causing death during the course of 2022.
I'm glad you bring up that comparison with TB. That's what was cited at the beginning of COVID-19. But of course, then the death toll went up, and we know that we weren't even recording the actual number of deaths. Professor Nel, in this article, you've both waded in even on the debate of whether COVID-19 is becoming like the flu or not. Do you believe it is?
Well, in terms of the number of deaths it is likely to cause this year, it will probably approximate flu, yes. So it's important to distinguish the fact that, whether it's intrinsically severe enough. In other words, when we started with COVID 2 years ago, the amount of deaths that COVID has caused in the last 2 years is probably north of 290,000 people. So that's well in excess of influenza. But now, as Professor Mahdi says, we're in a different phase where we have so much population immunity from natural infections and partly from vaccination, that now we're in a place where we probably will have about the same number of deaths from COVID as from flu in any given year.
Yeah.
So it is yet time to look at these restrictions, and with the new understanding of the virus and understanding where we are in the context of immunity, to see which of those restrictions still need to stay and the majority of them can be lifted.
Well, your argument is basically that the state of disaster gives government flexibility to deal with the COVID-19 pandemic. Now you're saying that the costs to society are no longer acceptable. You go as far as saying ongoing restrictions in hospitals are unnecessary and cruel. Professor Mahdi, you go as far as saying that sanitizing is not necessary. No longer testing at borders. So basically, we bring down all the restrictions. Is that what you're saying?
Sanitizing is absolutely necessary. It doesn't protect you against COVID-19, but it protects you against many other diseases. And I think one of the sort of rollover of the type of regulations we had in place is to continue encouraging sanitization of the hand. But it's got a nominal role when it comes to protecting against COVID-19. And certainly the type of regulations that still exist under the Disaster Act are detrimental to society. Aside from the economy, it's having a major impact on education of children, on the development of children, on the mental well-being of children. When it comes to hospitals, when parents were being denied access to hospitals, when the children were being admitted because of fear that parents might bring the virus into the hospital, that has got huge implications on the well-being of the child. So there's a number of regulations that are still in place, which are completely obsolete, that need to be removed immediately. Yes, something such as a such as the Disaster Act social grant that was provided should continue, but there's other frameworks to continue those aspects of it.
Professor Nel, do you agree? And let's talk about children specifically, because the huge debate right now is whether rotational learning should continue. It seems like even the Basic Education Minister is not in favor of that. However, some have raised the fact that some youngsters do get COVID-19 and also they are the conduits that pass it on in cases to older people.
Well, I think it's important to acknowledge that while at any age group there are going to be a few people who get sick with COVID very seriously, with school-age children, that proportion is extremely small. This is an extremely robust cohort of people. In other words, this is a group of people who are not going to have high volumes of severe disease. And the cost of things like rotational learning or closing schools every time there's a handful of cases is enormous. We have enough challenges with education in the country at the moment without halving the amount of schooling, or sometimes even worse than that occurs. The best way to protect those who are vulnerable, such as some of the teachers and such as the family members, such as the elderly family members of those school-age people, is vaccination. And to the extent that that's what we need to do, we're fully in favor of that, and we should absolutely be vaccinating as many people as possible. But really the way to get people back to school is not to try and prevent every infection in a young child and to try and prevent outbreaks from happening. Outbreaks are always going to happen, especially in the school area. What you need to do is prevent the severity, which is really about taking the vulnerable people, the teachers, for example, and some of the elderly family members, and getting them vaccinated if they haven't been vaccinated. The costs otherwise to school are enormous, and the well-being, not just psychologically, but educationally, and also the knock-on effects of having children stay at home and needing carers at home are absolutely astronomical. And it really has to get back to somewhere close to normal, in my view.
And staying with you, Professor Nel, you talk about vaccination, and it's often said South Africa still has a very unvaccinated population, but you're talking about natural immunity because of Omicron, and the research is saying natural immunity is better. Are we in a fortunate position because, ironically, Omicron spread so quickly across South Africa?
Well, I think it'll certainly help natural infection. And I think there's a lot of debate about the relative value of natural infection versus vaccination. And I think on balance, it probably is true to say vaccination is still better than natural infection in most ways. It's certainly the safer way to get immunity by a long way. But nonetheless, what we are saying is that it's not just vaccination we need to look at. And natural immunity does at least offer protection for severe disease. In other words, the sort of disease that ends you up in hospital or ends you up even worse than that. And really, that does seem to be holding up very strongly. And so when you put that together with the amount of vaccination we've got, we have a huge amount of immunity in the population. And as Professor Mahdi said, probably 3/4 of the population before Omicron, and well in excess of that probably after Omicron. And when you put that together, it's really the rationale for saying that is why we believe we're in a different phase now than we were at the beginning of the epidemic.
Yeah. Professor Mahdi, in this article, you do actually touch on an argument that's often used, even by experts who we often hear say, let's let our guard down. And what if something worse than Omicron comes in future, something that mutated not to become a less serious disease, but to become more serious? And then we as a society are unprepared. That is the argument. Is it valid?
No, it's not valid, because we need to build up healthcare systems irrespective of what we expect with this particular pandemic. And that is where South Africa came short. We didn't have resilient healthcare systems to start off with, and it can't be just because of the pandemic that we build up our healthcare systems. It needs to be entrenched into our society. Now, the chances of the SARS-CoV-2 virus mutating to the extent where it's able to evade what we refer to as T-cell immunity, which is what probably protects against severe disease and death, is nominal, extremely, extremely low. And in fact, if that happens, for all intents and purposes, we would be dealing with the pandemic virus on top of a pandemic. And there's an equal likelihood that we could have another virus completely separate, different to COVID-19 that causes another pandemic in the next 5 to 10 years. So do we continue with these regulations, waiting for something that might happen? Or do we use the best science available to us at this point in time to make an informed decision, an informed prediction as to the way forward? And that informed prediction right now is that it is extremely unlikely that we're going to get a variant which is any more different than Omicron in terms of evading that part of the immune system which many of us have that protects us against severe disease and death. We can do better, as Dr. Nel mentioned, by increasing our coverage of vaccines and particularly increasing coverage in people above the age of 50 who still remain at the greatest risk of ending up in hospital and dying of COVID-19.
All right, thank you for that explanation. I've got time for a quick question. Professor Nel, is fogging, which we know is still going on in some governmental departments, a scam?
It is basically a scam. It has got no value whatsoever for COVID. And this has been said clearly for over 2 years. And it is nothing short of a scandal that institutions continue to use fogging, either in healthcare facilities or in other governmental offices or non-governmental offices as well. It's crazy. It doesn't help for COVID-19 and it needs to be stopped absolutely straight away.
All right, thank you for your time tonight, both calling for an end of the state of disaster. The head of Infectious Diseases at Wits, Professor Jeremy Nel, and Professor of Vaccinology and Dean of the Health Sciences Faculty at Wits, Professor Shabir Mahdi.